Have you been struggling with hip pain or upper hamstring pain that has been limiting your running? Maybe you've decreased your miles of your long run or started running at slower paces than you normally would. Have you seen a local provider, medical provider that just tells you to stop running? Have you tried Googling your injury and tried various exercises, but you just don't know which ones are best for you? Would you like to run pain free and get back to running more miles than you ever imagined? If so, I have just the story for you to be inspired by. Gretchen experienced this and felt this way too. So listen in to my interview with Gretchen on how she got her running back and her life too. Gretchen just finished our 16-week Healthy Runner coaching program and actually just signed up to continue working with our team through our longevity program, where we map out 2 training cycles for you to get long-term changes, because we're all about lifelong running and not only running for one goal race here at Healthy Runner. I just needed to share her story with you because I know it will provide you so much hope and inspiration for those of you who are struggling with getting back into running with hip or upper hamstring pain. So thank you so much for accepting my invite to come on, Gretchen.
Thank you. My pleasure. I'm excited to talk today.
Yes. Yeah. This is going to be exciting. And guys, in this chat, Gretchen really is going to share how she got some clarity on what she needed to take her running to the next level. Um, you know, we, if you've ever wondered, I guess, what it would look like to work with our Healthy Runner coaching program or someone on our team, you're going to hear from someone who experienced it herself and worked with me personally and is now working with Coach Whitney on our team. This is, like I said, will provide you a little bit of hope. If you have hip pain and you don't think that you're ever going to meet your running goals because you're in pain right now. And if you guys are watching the video version of this episode right now, as always, drop any and all questions in the comment box, whether you're watching this on Facebook within our Healthy Runner Facebook group or on our Spark Healthy Runner YouTube channel, and I will answer them personally. The fears and obstacles that, Gretchen was experiencing. She's just one of the many Spark winners that we have in our Healthy Runner coaching program, who has really accomplished some amazing things with her running and health. And I think, hearing her story and sharing her experience will help you get through, what you're struggling with right now. So Gretchen, if we can just kind of provide a little introduction of, where are you from? Where do you call home? And tell us what you do.
Yeah. So my name is Gretchen Hoke. I am actually from Medina, Ohio, which is about a half hour south of Cleveland, if anybody knows the Ohio area. I actually am a professor of journalism at Kent State University. So that's what I do when I am not running. I am teaching at Kent State. So been sort of running like all my adult life, but didn't, sort of like the 2-3 mile, just sort of staying fit kind of thing until a couple of years ago when I really got into it and started seeing how far I could go is basically it.
Yeah. And how many, because I know you ran your first marathon last fall before we started working together. How many half marathons, did you run prior to that?
Yeah. So I was actually this morning, I was thinking Dwayne's going to ask me how many halves I've run. And so I was trying to get back there and count. There was a couple there was like 1 or 2 virtual ones in there that I was forgetting. So as I was like gathering my, my number, I was like, I swear there were more. But I am 8 or 9 half marathons at this point. Had been running quite a few. And then obviously, like everybody else, when COVID hit, got sort of stymied a little bit and then was back at it. So yeah, so I really love the half marathon distance. And like you said, did my first marathon in the fall, but really, really just love running halves. They're a lot of fun.
Yeah, and I remember you actually posting about your first marathon last fall within our Healthy Runner community on Facebook. You've been in there for a while, and we've seen, I remember seeing your post. You have some great posts of you and your dog taking some selfies together as you grab your dog for usually your cool down miles
Yeah.
after your run. And I've always seen your face and your posts, and I've just loved, all of what you've been doing with your running. So it was such a treat, honestly, for me, to kind of get to work with you personally and get to know you a little bit better through our coaching program. And yeah, let's kind of go kind of that to that moment, when you decided to kind of reach out before you started working with us. What was the scenario you were facing, with regard to your hip pain that you were having, as well as the upper hamstring pain?
Sure. So I had really started kind of pushing the distance and got into the mindset of sort of like, let's see how far I can go with this kind of thing in the spring of 2019. So I had, just sort of like building miles. I had no idea what I was doing, just running and working out, and had gotten into this mindset of really wanting to push myself and really, feel great physically and see, see what I could do. So my cousin, who'd been running marathons and half marathons for a long time, was like, you should run a half marathon. And I said, okay, what do I do? And she's like, well, just keep building, your long runs. And I'm like, okay. So, without any knowledge, I hadn't really started reading or, learning about running or anything. I set off to run my first half marathon. And in the process of that, about a month out from the actual race, I injured my hip the first time. So it was my right hip. And I think I joked with you, it was called it the upper butt muscle. It was, I could feel it right from my hip all the way to my, to my back, where my, tailbone, or not tailbone, but, the bottom of my spine is just that whole connector muscle. Really, I was doing an 11-mile long run and it just wham out of nowhere and I couldn't run. So obviously now I know it was a complete overuse issue. I wasn't taking rest days. I was like, look at me, I can work out 12, 14 days in a row without a rest day, not really understanding that you can't do that after a while. So fortunately for me, I'd set my eyes on this half marathon, and fortunately that happened about 4 or 5 weeks out from the half, and I couldn't run it. It was injured. I was hurt. And so I managed, with about 2 weeks off, I managed to get back to, to running, and kind of sort of did the whole like, look, hip, give me this race, and then I will go see a physical therapist. I promise you. And that's what I did. So I ran the first half, never having made it past 10 miles because I was trying to work up to 12 and never got there because of the hip. So I really gritted it out, and sort of amazingly, I look back, I don't know. I mean, I didn't fuel, I didn't drink. I knew so little about what I was doing, but I did really well. But I was hurt, so I did manage to run that half. And it didn't really hurt that much, but it was almost like my body had said, yeah, okay, well, this was the agreement. Cause I swear, like the next day I could barely walk, and I was like, okay, well, I told you, give me this half, I'll do the PT. So I did physical therapy. And it worked.
Just
Oh,
one
sorry.
one moment there, Gretchen, just
Yeah.
because I think you overlooked a big part in that. You really put mind over matter, and you put the mental side, and that is so hard. That is a difficult part that some runners struggle with, is to kind of that mental side of racing, to overcome challenges. And clearly that is one of your strengths, because if you didn't build up the training properly, and you physically really weren't in the best shape, and you were having pain, but you were still able to accomplish it, it just speaks to your level of motivation and your level of mental fortitude to overcome those challenges and those obstacles. And that is going to be a good trait for your future races that will be upcoming, that we'll talk about later.
Yeah.
But that is something that I want to stress, is like, you basically just had the mental wherewithal and grit to like, hey, I'm going to grind this out. And I think a lot of people have been in your situation, especially when it comes to injuries. And sometimes we can do that. And then after your race, so now you did actually see a physical therapist, right? So tell us about that.
Yeah. So, and yeah, I think you're right. I think that is probably one of the reasons that I really love running, is there is that level of, I am just going to do it. And, kind of like feeling that amazement kind of in yourself, knowing, all right, you're in no position to do this, but you're going to do it anyway, because you've put in, the work. And so yeah, there was a huge piece of grinding it out. And I just went into it saying, you won't stop. you're going to go and you're going to finish it. And I did. So yeah, but I think that's one of the things that draws me to it is that challenge of mind over matter sort of thing, mind over miles, as they say. So yeah, physical therapy was good. Fortunately, I'm fortunate that I'm close to a physical therapy center that is it's a sports, it's like the PT Center for Sports Medicine. So it's like, the guy that I worked with did triathlons or still does them. So I was fortunate in that I wasn't told to stop running, but I was very much told that what I had done was an overuse injury. So that's where I started to realize that if I was going to do this, I was going to need to start to learn what I was doing, because as I was going first, I went 3 times a week, and then we went down to 2 times a week. And then I finally got down to 1 time a week. And that was probably, so I ran the half in September, started right after that. So October, November, and most of December, I was in physical therapy, fixing, the hip issue. And it did, and it worked. And I was running while I did it, but I was confined to flat running, and I'm in Ohio, and there is no flat where I live, with the exception of my cul-de-sac. It's a rural cul-de-sac, and it's a mile. So literally I ringed my cul-de-sac over and over again. And it was the most boring experience of my life. And I do have a treadmill. So there was treadmill miles in there too, just trying to stay flat and allow that hip to heal. But I was like, if I have to run this cul-de-sac one more time, I'm going to scream. So I was excited when I was, sort of graduated into getting back to being allowed out onto less flat spaces. So it worked, and the pain went away. And I was able to start running again, started running races again, started getting into trail running, did a trail half and stuff like that. So yeah, it worked. And I was, I was pain-free, at least in the hip standpoint for a while, which was good.
Okay. So that kind of upper hip area. So this is in the backside, kind of in like the glute or your SI joint area, for those that are familiar with the SI joint. So you got that pain relief. And I thought you brought up another good point, that I do want to stress, is that I am a firm believer in finding a practitioner that either is a runner themselves or really works with a lot of runners and understands the demands of running and the specific kind of treatment, exercises, things that are really required for running. So for those that are listening, find a good local practitioner who specializes in working with runners. It does make a difference. From someone who has treated in hospital-based clinics, private practice clinics throughout my career, there is a huge difference, because we, as I'll just speak to the physical therapy profession, we graduate with our DPTs, our doctoral degrees, as generalists. And, we're able to screen and be able to go into any setting that can treat any population. So you can treat a stroke patient, you can treat pediatrics, you can treat geriatrics, right, along the spectrum. And it is a generalist. So if someone is not familiar with the demands of running, they're not a runner themselves, they haven't taken continuing education courses and like treating running related injuries, it is a disservice to you, because a lot of the information you usually get, and Gretchen didn't, which was awesome, is, just stop running, like let your injury heal and then go back to running when I discharge you. And if you listen to any other previous episodes, you will know my take on that. And that is not the best really treatment for your injury, as well as your mental health and doing what you love, which is running, right? We all love to get out there and get those mental miles in. All right. So that problem kind of gone away a little bit. And then you did run the marathon itself.
Yeah. And I had started, prior to the marathon, and we had mentioned that I started having that sort of like upper hamstring issue, that was part of that creeped up when the pandemic started, and I had blamed sitting. I blamed it on sitting. I did, so yep. And that one definitely never stopped me from running. That was more of a that was more of something that crept up and was bothering me when I wasn't running. And since obviously I only run a few hours a day at a time, so the vast majority of the time that was hurting. But yeah, so so I got to the marathon, and was training for that, and obviously better educated in terms of all of that, better fueling, better training. I had a training plan, and was doing really well. But then the other hip acted up. So probably I was in pretty, I want to say like I trained to 22 miles. That was part of my mental, like, I could
Mhm.
picture, I could see 4 miles in my head. I couldn't see six, like I needed to know that I had gotten to 22. So I think it was
So
either the
you're a
18 or
type A runner, like most of
yeah.
us.
Like,
Yes. Okay.
like I
Got it.
need to know, like I know
Many
what
people
four
can
miles
relate.
is. Yeah. So it was either during like that 18 miler or that 20 miler, and the hip started to get sore, but then it was my left hip. So it was the same pain. It wasn't the sudden severe pain that had stopped me from running, previously, but it was sore. And the more I ran, the sorer it got. And so I kind of did the same thing again, was like, I just let me run this marathon and then I will fix you. But, just like, it's like, talk to your friend, the right hip. I told the right hip what I would do, listen. So it wasn't, I definitely didn't have to stop running, but it hurt. And I was doing a lot of rolling, and by then I was, very much invested in the Healthy Runner resources. So I'm, rolling and I'm looking up through all the things and I started to do, try to do some exercises. But I think my mistake there was that I had pretty much stopped strength training. I was so tired from the building of the miles that I was kind of like, at this point, you don't need to strength train, just rest on those days and whatever, which I think in retrospect did a disservice to me, because I think I should have been at least doing it like once a week still. There's, again, you live and learn sort of thing. So,
Hmm.
but yeah, I managed to get through it and was able to do the marathon. It was definitely hurting by the end of the marathon, but again, sort of that, keep going, don't stop. You're almost there. Again, it helped that I had gone to 22, because by 22, I was pretty much, baked, but I thought, what 4 miles is, and it's, you can do that. So, so I finished it and, was really proud. I never stopped despite the things, for the first half felt good. And then as the second half of the marathon waned on, the hip really started barking at me. But, aside from this, there's a 2 mile uphill. If anyone is familiar with the Akron Marathon, there is a 2 mile, 18 to 20, that is violently uphill. I mean, like, just the most awful. And I knew it was coming. You're mentally prepared for it, but it was a tough haul, and that's where the hip really started hurting. So I did sort of have to walk around that hill, get up those 2 miles, and then keep going. But again, I finished I think my hubris got the best of me, because I ran the marathon, felt really awesome, and didn't get the physical therapy that I told myself I would, because I felt better. I wasn't running all those miles. And a month later, I ran a half marathon that was on the tow path, which it goes along a river. It's all flat. And so I'm going to use my training and I'm going to run this half marathon. And I did, and I ran it well. But by then I was in some pretty good pain, and now it was hurting all the time, and I could still run, but it just hurt. And so, I had gotten to the point where I was just really busy. I was obviously more, knowing more about your program and what you were doing. And we had talked a couple of times, but I got to a point where I was like, I need physical therapy. I said I'd get physical therapy, but I don't have time. I just didn't have the time. I was very, very busy, in November last year. And even my daughter actually was in physical therapy. She had hurt her back doing back bends, because she's not a gymnast and is certainly not built like one, but declared herself someone who was going to teach herself a back walkover. And so she was in physical therapy already. And there was no time. And so that's when I reached out to you, because I thought I need help. I need to fix this the right way, but I don't have the time. And the appeal with working with you was that I could do it when I could do it. I could get up at 5 a.m. and do these exercises when it fit my schedule, versus having to try to figure out how I also got myself to physical therapy in addition to all my children's activities and work and her and my daughter's physical therapy. So that was about November, and I had put it off long enough. And I think my hip was like, you promised, so, we're not letting you out this time. So,
Okay. So you were still, just kind of recapping there, you've basically been in somewhat of an injury cycle. Like, you're highly motivated, you're looking to do hard things. You are a busy working mom. You have two kids, right? Two kids?
yeah. Yep.
Yep. Two
10 and 14.
children.
Yeah.
Yeah. And you've done strength training before, because I've seen your gym in your basement. Very impressive.
Yep.
So you weren't unfamiliar with strength training exercise, you built up for your first marathon, but now you've
Mhm.
had the cycle of like half marathon, marathon, half marathon. Hey, I'm getting this pain. I'm in this kind of injury cycle. So you made a decision to kind of get some help on it. You
Mhm.
decided to do something a little different than you did last time,
Mhm.
mainly for a time factor. And you didn't have time to go to PT 2 to 3 times a week for 4 to 6 weeks or 8 weeks, whatever
Yeah.
it would take. And I remember our conversations, and I guess, were there any hesitations on joining the program?
I think just because I think my only hesitation was, again, I hadn't met you in person. I'd never done, virtual physical therapy. I had been lifting weights. I'd worked with a personal trainer to learn how to lift weights. So I knew that I had enough knowledge to be able to do whatever you would ask me to do. But I think that was just my hesitancy was like, really, this is like an internet guy and he seems pretty knowledgeable, but like, you've never met him. And, so I think that was the only hesitancy. And so I know I asked a lot of questions and, really sort of thought about it because I was sort of a leap of faith in that I'm committing to a program that I had, obviously I'd seen your videos, I'd seen your resources. So I knew that, you weren't faking it. Obviously, I knew this wasn't all made up, but at the same time, I was like, I've never met him. So what, I think that was it. So, but I think, just again, knowing that I had seen all of your resources and we had talked and I really felt comfortable with everything that we had been discussing. And I thought that you would be someone who would listen, who would, hear me out and let me work this into when I could. I think that was probably the tipping point is, you saying, yeah, if you've got X amount of time every day, we will do it in this amount of time every day. And I thought, what the heck, I'm not going to hurt more, right?
Right, right.
I'm not going to, it's not going to get worse. And I only have, I need to do something to get it better. And I'm, where I was, like I said, in terms of time and the ability to invest in it, I was like, this is my best option. So, so go for it and see what happens.
Yeah. And well, first off, I think that was the first time I've ever been called an internet guy. So I don't know if that's a positive thing or a negative thing. Like,
Yeah, it's
have I
not a
made
positive
it
thing.
in the world
Yeah.
where people think I'm just not like a normal
Actual
human,
human. Yeah.
running PT and coach, that I'm like an internet guy?
Yeah.
But I do remember, some of the hesitations after our initial call. And, this is something that is common. I think that when people, sign up to work with us, and to your credit, you're like a very informed consumer. You ask very intelligent questions. I remember some of the questions you had asked me, and I was like sending you voice memos back, um, answering those questions because they were like great questions, in terms of like the flexibility with timing and you only having a certain number of hours before you have to go to work, and you can't run for more than an hour or do an hour and a half strength and run on the same day. And we had talked through some of those hesitations, and I'm just so glad that we did that, because you wouldn't be where you are today if we hadn't done that. So I think
Mhm.
that's important to know is, number one, before we ever have anyone join our program, they're getting on a call with me because I want to make sure it's a good fit. And we've had some folks, and there's only been a couple that kind of slipped through the cracks that weren't a good fit. And I didn't make the appropriate decision on the call, but there are many calls that I actually have with people, and I just know it's not going to be a good fit, whether or not they're truly not motivated and have the dedication like that you did, to
Mhm.
actually fix the problem, or they're just don't seem coachable, that they're stuck in their ways and they want to do what they've been doing for the last 2 or 3 years and they're not getting faster and they're wondering why. So,
Yeah.
I knew you were a great fit. I knew, the injuries that you were battling, that we were going to be able to take care of that, and also improve your running at the same time. But I think it's important to know that, we do have a conversation and we go back and forth, and because it is an investment, right? It's pretty good investment for, your running, your health, and we want to make sure it is the right fit, if you are going to invest in a program like this. And quite frankly, we don't want to work with people who aren't invested in actually, being coachable and taking care of the problem. And
Mhm.
so I knew it was going to be a great fit, honestly, from day one when we had met. So kind of just setting the table there. So like part
Mhm.
one is kind of, you're in this injury cycle. When we started working together, it really elapsed to kind of this right PHT pain, proximal hamstring tendinopathy, that you were
Mhm.
having mainly with sitting. You know,
Mhm.
your commute into work, 45
Oh,
minutes
it's
was kind of
excruciating.
was bad at that time. You know, you told me in the beginning your sitting tolerance is like 10 minutes, really, before you
Mhm.
started feeling some pain. And this is
Mhm.
very, very common. This is a common injury in many runners. There's a lot of runners in our program who have had this pain, and it usually doesn't, like you mentioned, depending upon level of irritability, actually limit your running unless it is really irritable. And then people start feeling it on the longer runs, and then also with elevations. So when they're going up hills, usually, but it is something that limits with sitting. But the
Mhm.
strategies to get it better are included in your run plan and the specific exercises that you get for this condition. And then you were also having this kind of like little combo here. We had 2-for-1 special where you had the
Yeah.
left upper butt
Yep. Yeah.
pain in that
Always my
PSI,
problem. Yeah.
in that PSIS region, like your upper glute. And that was more achy pain with running.
Mhm.
Um, and you said it hurt like after your runs, sometimes more after the runs than even during the runs.
Mhm.
And you were doing Advil, you were doing ice, you were doing some kind of cobra stretches,
Yep.
to kind of take care of that problem. So just if anyone is kind of battling similar pains and issues, just to kind of give them some context of what you were kind of battling during that time period.
Mhm.
So while working together, in our, program here, what were some of the things you noticed kind of like right away that were helping and worked well for you?
Yeah, I think and it's funny because we started with sort of that restore phase, and you said we're going to do these exercises specifically to start to heal the parts of you that are hurting. And I think it was fortunate that I had been in physical therapy before, because we weren't doing the same exercises, but I recognized, okay, this feels like nothing, but I know that it's doing something because I've gone, through this sort of thing before. But I did still even have a little of that kind of skepticism. I was like, really? Like, this doesn't even involve all weight. Like, how is this, my own, total not really knowing. I'm like, how is this even helping me? I'm not even lifting something.
Right.
But it was so quickly that things began to feel better that I thought, okay, now I can't be skeptical anymore, because these sort of like humblers and my leg going up and down a wall, this is actually doing something, because I just started to feel better. And it really did start to help quite quickly. And I think I began to see that, despite that I had been, lifting weights and I had done legs and leg day, for a while, but I was doing things that were, like you always talk about, very specific to running. And those other things that I had doing, while great for my legs, weren't necessarily running specific. And I very quickly began to see that, wait a second, there is something to this. It's not just squats and whatever. Like, there is something to these movements, and to really concentrating on those types of muscles. So early on, I think, like I said, I was that sort of like, okay, whatever, yeah, this is going to do something. But then it was so quickly starting to, I could feel it. And I thought, all right, now I feel bad about being skeptical, because this is actually working. So yeah, I think those were some of my, that was just sort of the initial thing, is that first sort of like skepticism, and then very quickly realizing that, there was something to this little blueprint that you had given me. And I was willing to, to stick with it, because I was seeing the merit of it pretty quickly.
Yeah, and that's very common, by the way, for you to feel what you were feeling. And I know many of our clients feel the same way. And if you remember, like on that first, kind of run body performance assessment that we did, and I try to do my best to kind of educate you on why we're doing what we're doing during this restorative phase. And it is so important to kind of teach your brain how to activate the proper muscles. And that's kind of the goal, is to kind of turn those on. And that's what PTs do a wonderful job at, especially if you're going to someone who is actually like watching the exercises that you're doing in the clinic. And is really teaching you how to activate those muscles. The problem that I see in really the rehab of runners is kind of bridging that gap of going from how do we activate and now how do we load and how do we progress and build strength. So that's one of the things that kind of I love about our program is that, I designed it with that intention to kind of activate first and then strengthen over time and progress that strengthening. So then in the long run, pun intended, you are stronger for the long run, right?
Yeah.
So, okay. So those are some of the things that you noticed that, hey, I was initially thinking like, these exercises seem kind of easy. I'm not even using a weight. Like, is this going to work? But then once your pain levels kind of decreased and you were like, hey, this is actually working, then you're kind of all in and kind of, believing in what we were doing. And so
Yeah.
let's talk about kind of like we talked about. Part one is like you're struggling with this reoccurring hip issue, hamstring issue. Part two is kind of you've been through, the program itself. What did you wind up accomplishing at the end of the 16 weeks of you and I working together, by the end of the program? And where was your running at that point?
Yeah. I just feel again that pain, was gone. Thankfully. It was, just from getting it off your mind standpoint, it was great to be able to run without all this hip pain and sort of fearing that injury is coming again, sort of always having that like, oh, is this going to become something that stops me from running? Is this going to become something, not having to have that mental sort of pressure of wondering, like listening to your body with every step you take. What was that? What was that? And then just from the hamstring portion, just really being able to drive a car was lovely. And being able to sit when I needed to sit was lovely. I was worse than a toddler. I was just shifting and always moving and standing when you should be sitting. Why are you standing? Well, I don't want to sit. It hurts. All of those things having gone away. I think I didn't even realize the sort of mental effort it was taking to kind of always be thinking about those things, because I really do want to run and for a lifetime. I want to do this until I'm, too old to, or until someone tells me I should probably stop and then I'll probably bike instead, but so I want to be able to do that and to be able to not be thinking about these like pains as potential barriers to that is a great mental load, sort of off of your brain, for lack of a better way to put it. But I think, I've also really noticed, and I was just thinking about it the other day, because I ran I ran a half a couple of weeks ago, a very hilly half. And I was truly amazed at the difference in how my legs felt, because I think even when we started, with the weight bearing stuff and getting into the different phases of the strength program, I was still kind of like, okay, this doesn't really feel like gym work. I'm using these bands and I'm doing these things. But all of a sudden I'm running that half and I'm like, why? I wasn't, my legs were not tired. And it was just a really kind of odd, very exciting feeling, because I went up and down and up and down, the whole time. And I, wasn't tired. My legs weren't tired. And I would go up and down those hills and hit the next one. And it was just really enjoyable. And that I think is the biggest thing that I've noticed, is just the strength in my legs. And it kind of crept up on me because again, you're not really thinking about it. I'm doing these exercises that I'm told to do, and I'll do them because, I've committed to this program and I believe in what you're telling me. But then it's sort of that all of a sudden aha moment going, oh, wait, this did something, this is working. And so I think that was my biggest takeaway, is just, I could feel the strength. I could feel the difference. And I think that also gives me more confidence in that I'm not one step away from another injury. I feel resilient. I feel stronger. And that's been great too.
Yeah, so taking away some of that fear of like, hey, if I run this, mile a little faster, I'm gonna start feeling my pain again. Or if I run, this distance on this long run, is my pain gonna come back? And just, taking that off of the table and not having to worry about it is definitely something that can be very, reassuring. Your runs don't turn into stress, right? We should be running to decrease stress, not increase
Yeah.
stress. um, and the strength part, I just love hearing that, because from someone who started out in the gym, I was a gym rat for 15 years before I even started running. That's always been something I've taken for granted. And when, even folks like yourself who have been doing strength training, really get into like the running specific strength exercises that are in our program. And I just love hearing that your runs feel more effortless. Like you don't feel so hard. It doesn't feel hard to get up a hill. Your legs aren't the limiting factor. And like, I love when people are telling me like, hey, it's my breathing that's the limiting factor now, right? Or like my aerobic capacity. And like, I just don't have the cardio there.
Mhm.
Because the legs and, just curing that problem, so to speak, and taking care of that. I just love hearing that. And what would you say, was one of the things that you liked, best about the program? It worked really well for you during our time working together.
I think it was that sort of combination of allowing me that autonomy to just do it when I was able to do it, but also having that guidance. So, I'm a highly independent, highly autonomous person. So I want to be able to do things when I can do them. And I think that the program allowed me to do that. But there was also a real responsiveness to my questions or my needs, for lack of a better way to put it. I remember when we first started the strength program and you had given me one and it was too long. And I
Mhm.
just, texted or emailed and I said, hey, this is awesome, but I just don't have the time. And it was within 24 hours, I had a new strength program that had pulled out the pieces that I didn't need and that would be able to be done in an hour. And I thought that was great because I don't know what to lose out of that program. I don't have the expertise to be able to say, well, which one of these could I not do? And you did that. And, I think that was really great. And the same thing with, I think there was one time where I was supposed to run like 12 miles or something. And I had texted and I was like, look, I gotta be honest, I'm pretty beat. Can I do a down week? Could I still do a long run, but one that's not so long because I'm feeling like I need a bit of a down week. And you were like, yeah, boom, here it is, do this instead. And I really liked that because I had a voice in it and there was a responsiveness to, what I was saying I needed or did or couldn't do, while also allowing me the autonomy to go out and do it when it worked for me. So I think that was really great. There was just a great combination of being able to do it my way, if you will, but within the helpful structure of guidance and knowledge that's outside my own knowledge base.
Right. So really providing that flexibility you needed to be able to focus on the things you needed to focus on, as opposed to someone else, right? Another runner who is going through our program. And yeah, that's what I've loved about our kind of personalized one-on-one coaching, because, and I'm not sure if you even knew this, but, prior to this program, like we used to do a lot of team-based coaching, and it was a little bit more because there was more people in it. It was kind of more pre-formatted. Like we classified you based upon your intake, whether you were at like beginner level, intermediate level, or advanced level. And it was like 3 programs, and these are the exercises these people got. These are the run plan that they got. And that's one of the things that I've really enjoyed in working with our kind of one-on-one personalized approach is, yeah, we're going to basically, provide you the clarity that you need to focus on. Like, what are your sticking points? For you, it was this hip pain, this hamstring pain, and like, how do we overcome that hurdle? How do we continue to improve in your running with the time constraints that you had with the kids, with work, with having limited number of hours a day to actually get your runs in, get your workouts in, and you had big marathon goals. So it's like, how do we take all these variables and really focus on, and that's kind of what we do in our program, is kind of take the guesswork away from that. So yeah, no, I'm glad that's been helpful for you. And I do remember redoing your plan. I was like, I remember when you had said that and you were almost like a little hesitant to ask. And I was like, oh no, I got this. Like, and I love that. And I love that challenge of, creating a program and designing a program, because that's one piece of what we do in our program, is the design standpoint. And there are other like run coaches out there who just like design plans and then just give them to people. We don't do that, just because we don't feel that's going to give you the result that you really need to make those in-game modifications like we had to make, right? So we were making modifications as we were going along, and then providing that support, accountability, right? And yeah, there were many modifications we had to make. We had a little non-running related injury that we had to deal with. But yeah, that's what I love about what we're doing. And can you just speak to, I know you just started working with Coach Whitney in our longevity program, but what are some of the things that you're seeing? And obviously, you're happy with the results that you got with our program, and decided to continue. And now, and this is somewhat for which you initially came into the problem with that PhD pain, which I was like, all right, I got this. I've gotten so many runners better from this condition. Like, this is like, I can pretty much guarantee you're going to get rid of this pain, right? And work on your running. But then by the end, you didn't have any pain. So I'm like, you don't necessarily need me as a running physical therapist and run coach to work with. And that's where, the coaches in our team come into play. And, you really had goals of still running a marathon. And because of that kind of other non-running related injury, we had to put that on hold, which was a very smart decision, by the way. And you really wanted to focus on like a fast half marathon and then a fall marathon. So I was like, Coach Whitney is going to be the best person to actually get you to that and those goals. And then you still have me here on the team. If for some reason, knock on wood, right, any of those do wind up coming back injury wise. But how has that been going for you? What are the things that you've noticed? I know it's, hasn't been too long that you've been working with her, but, what are the things that you've noticed so far?
I think, I think for anybody who's hesitant about getting into something like this, when I was first still trying to decide if I should start working with you, I was talking to my husband about it, and he said, look, this is your thing. This is what you do. Invest in it. It doesn't make any sense to not. And I think I had, working with a running coach in general, I'd always sort of kicked that idea around, but been like, it's money. I could look on the internet, I'm, well-researched. I'm no dummy. I can do this.
Right.
But it makes sense. I've just deciding, sort of jumping in and working with Whitney. I'm saying to myself, I probably should have done this sooner. Because I think her knowledge is going to always, a good coach's knowledge is going to exceed mine. It's going to exceed what I'm able to learn myself. And, I may be a smart individual, but I am not a certified run coach. And so there is only so far I'm going to be able to take myself. And that coach, like Whitney, has more knowledge and she can take me further. And so I feel like it's definitely, I was beginning to believe I had gotten myself as far as I was going to be able to do so on my own. And these past couple of weeks working with Whitney have sort of shown me that that was a good decision, that yes, she's got more for me. And someone like Whitney can help me get better, get faster, but in the right way, so that I don't injure myself again. My dedication and sort of grit, I am prone to overtraining. I'll push through whatever you tell me to push through, unless you tell me to not to. So I think it's a smart decision, because I can see the logic in what she's having me do, and I understand it. And it's things I never would have thought of to do, but yet I see already that they're going to lead me to improve my speed, to, improve my capacity to do all these things. So yeah, I definitely feel like it's something I am confident was the right decision, because it's a wealth of knowledge I just don't have. And, I think you have to sort of admit there is only so far you can take yourself. And if you want to reach these big goals, it's important to get the right type of resources and invest in the right type of resources in order to make those goals happen.
Oh, so well said. So well said. And yeah, that is one of the things that we help a lot of runners in our community is kind of help them from beating themselves up, right? Or kind of being, a lot of my clients will say it's like, I'm my own worst enemy. Like I'll start adding in miles, in the training plan, or I will, run these runs too fast. And I need someone to kind of rein it in for me, right? And make sure that I am doing the right things. So I don't get, this fill in the blank reoccurring injury that I've been dealing with. So if you guys are listening to this right now and you are ready to take action and get the accountability you deserve to honestly unlock, your greatest potential as a runner like Gretchen did, we would love to work with you on getting stronger, running faster, and enjoying lifelong injury-free running. We have the same program that Gretchen just described to you, our 16-week 101 Healthy Runner Coaching Program, where we provide support, structure, accountability from experts, in the health and running industry. And we give you personalized, easy to follow plans tailored to your unique needs and your busy lives. So you can learn more about our program. I have a little behind the scenes video tour of our coaching program, and you can hear from, other athletes who have been in our program who are struggling with many of the problems that you're probably struggling with yourself, and, the same sticking points that you're having in your training, whether it is an injury or it is, you're just not getting faster. So if you want to learn more about that, just head and go to learn.sparkhealthyrunner.com/coaching. And you can learn more about the program. You can book a call with me where we'll get on a phone call, just like I did with Gretchen, and we'll see if you're a good fit. Like I said, we're very selective and we only take a limited number of runners in our program because it is very personalized. So there are a limited number of slots. So if you are interested, head to the website there, book a call with me, and I would love to chat with you. So Gretchen, thank you so much for taking the time today out of your busy day. I know it's finals week.
Finals and all that. Yeah.
So got to get grades in and all that fun stuff. But this was fun. It was nice to have you on the podcast. And, with just knowing you for a while now, I feel like I knew you right before you were in the program, and now I really know you, and now you're in our coaching community. So I just love that aspect, and hopefully I've increased my status now to not only being like an internet guy.
No longer just an internet guy. Yeah.
Awesome. But yeah, thanks again for coming on, and I appreciate you taking your time.
Well, thank you for the invite. I enjoyed it.
All right, guys. So as always, let's stay active, let's stay healthy, and let's just keep on running. Until next time.